Machine learning tools can analyze EHR data. EHR data helps to calculate the risk of suicide attempts. It provides information on which patients should be screened in a non-psychiatric clinical environment. On the one hand, diagnostics alone cannot determine whether someone attempted suicide last week or 10 years ago. Obtaining clearer and more complete data from the EHR could greatly aid the prediction model's improvement, thereby improving the care of patients with suicidal thoughts and behaviors. With the help of a 5-year, $2.7 million grant from the National Institute of Mental Health, researchers at Vanderbilt University Medical Center will use computational methods to shed light on suicidal ideation. This will also enable researchers to understand if thoughts create risk of attempted suicide. By using routine electronic health records, EHRs, scientists can predict suicidal ideation and suicide attempt, along with exploring the genetic underpinnings of both. In 2013 there were 41,149 suicides in the US, making it the 10th leading cause of death that year. From 1999 to 2017, the all-ages suicide rate in US increased to 33%. Nationally, some 8.5% of suicide attempts end in death. With the aid of a $1 million, 2-year contract from the US Food and Drug Administration's Natural Language Processing (NLP) will be enhanced to hone in on any text entered in the EHR. It touches the patient's suicidal thinking and behavior. Diagnostic coding by the healthcare team heavily undercaptures suicide attempts. Also identifying the timing and circumstances of these events from patient charts is especially challenging. With improved NLP of care team notes and messages in the EHR, the result will help better understand the scope of these problems, while designing better care programs to prevent them, enabled by the machine. As documented in the EHR, among the high-risk groups, 1 in 23 people continued to report suicidal thoughts, and 1 in 271 people continued to attempt suicide. During the 11-month test, VUMC hospitals, emergency rooms, and surgical clinics received approximately 78,000 adult patients. According to the subsequent records of the electronic medical record, 395 people in this group reported suicidal thoughts. 85 of them survived at least one suicide attempt, and 23 of them survived multiple attempts.